Whenever you're going to change anything like staffing or flow or anything, the number one thing is to develop a vision, and the number one thing is to think about a patient at the center. I always tell the story of this little girl that came into our emergency department. She had vomiting and diarrhea, a completely normal vital signs. In our old department, she could have waited 5 or 6 hours. But because we'd optimized our staffing, because we thought about that partnership of the provider and the nurse, she was brought in right away. Both the nurse and the provider said she doesn't look right. They did a spinal tap on her, and she had meningococcal meningitis. And it was one of those things that made you really realize that that little girl, that's a time-sensitive disease. If she had waited in the waiting room, she could have had a completely different outcome. And I remember clearly that Jeremy Cook, the doctor who saw her, got a letter from this girl's mom every single year. And he always says, at the bottom of one letter, it said, "Without you, my life would have been very different." So that's what I start the story with all the time, that it's not about anything else but us giving great patient care, but we want to make it easy for our people doing the work to be able to deliver that care seamlessly.